Welcome to Avaya, Kim.
Thank you so much. Thanks for the lovely introduction. Nice to
Yeah,
be here.
yeah, great to have you. Why don't you tell us a little brief background on how you got into this work before we
hmm
get going?
Yeah, it's always a common question I get because it's a bit of an odd job title, right? But basically, it was a fear of childbirth. I can put it all back to that, where I saw my mom who was experiencing bladder leaks and chronic back pain. She had episiotomies during her childbirth, and so I sort of grew up with a fear, but also a bit of a fascination about pregnancy and birth. And when I was pregnant, I did decide I was going to start a family, and I was determined to have a different story than my mom. So my midwives had recommended a product to me called the Epino, which is a biofeedback device to help prepare the pelvic floor for birth. And after I used this and I had a great experience with it, I thought, why is it that not every single woman giving birth is using one of these? And I contacted the distributor, the manufacturer in Germany, and asked if I could be a distributor in Canada. And it was supposed to just be a little side thing, but again, 18 years later, we're here. So that was the seed that planted it. I then learned about pelvic health physical therapy. I started an e-commerce store. I started a second business to optimize postpartum recoveries, created a certification program for other fitness professionals because there was a huge void. This pelvic health was not talked about in fitness at all. And then as I and my business partners were moving through perimenopause and now postmenopause, we said, really, this is a conversation that is not just about do your Kegels in pregnancy. We should be learning about it a lot earlier, and we should appreciate all of the changes that we go through as women, with menopause being a time where a lot of those things that we were kind of ignoring along the way start to show up a little bit more pronounced, or they show up for the first time. So now I sort of work with women through all life stages, but perimenopause and menopause seems to be the predominant group that I'm spending most time with.
Awesome. Well, thank you for sharing a little background on you and how you got into what you do today. And okay, so let's just talk about the pelvic floor, nuts and bolts, right? What is it and why is it important?
Mm-hmm. Yeah, I'll use my model here because that always helps a little bit. So this is a female pelvis, and we're talking about the group of muscles that closes off the base of our pelvis. So at the front of our pelvis, we have our pubic joint. If you were to sit and lift up a butt cheek and pull the flesh of your butt cheek away, you would feel a bone there. That's your sits bones. We have one on either side. And then at the bottom of our spine, here's our sacrum, and then we have our tailbone. That is another attachment point for the pelvic floor. So the group of muscles we're talking about attached to these 4 points, and they are responsible for a lot of really important things. One being pelvic and spinal stability. So because of the attachment points at the base of our spine and our pelvis, they play a role in our core stability, which everybody's heard of core fitness, but we've never been told that the pelvic floor is the foundation of it. The pelvic floor plays a role in managing our openings. So we have 3 openings in female anatomy. We have the urethra, we have the vagina, and we have the anus. So they help keep those openings closed when we don't want something to come out, and they help them open when we do want something to come out, whether it's pee, poo, fart, or a baby potentially. And also from a sexual response perspective, they play a role in allowing sensation, but also something potentially to come in with regards to insert of sex. And they also play a role in our organ support. So we have our bladder, our uterus. Sorry, my rectum's a little shifted over there, but bladder, uterus, rectum, and help them. The pelvic floor helps keep them up in their proper anatomical position. So these are really important jobs that nobody has ever taught us about. And we somewhere along the line have probably been told to do our Kegel exercises, but again, nobody's ever taught us how to do a Kegel or evaluated our pelvic floor to see if we're even doing them correctly. So they still remain this elusive exercise that nobody really knows if they're doing correctly. So that's what the pelvic floor is, and those are the all of the jobs that the pelvic floor has.
Awesome. Thank you. Yeah, definitely more than I could imagine, not knowing much about it. And I appreciate the visual representation too for people to get a better understanding. So how is the pelvic floor impacted by the menopause journey? Different stages, perimenopause, menopause, postmenopause. How does that all affect us?
Mm-hmm. We are influenced by lots of things in our life: fear, trauma, falls, accidents, surgeries, posture, exercise, pregnancy, childbirth, coughing, like so many things. Hormones and our menstrual cycle and the cessation of our menstrual cycle is another component that, again, we've never really thought about. So when we're menstruating, we have fluctuating hormones, and we also have a uterus that is getting heavier and, as it prepares to bleed. So there's additional weight on the pelvic floor each month. And then if that person does happen to become pregnant at some point in their life, there's obviously the weight of a growing baby and the hormonal changes that happen during pregnancy, as well as the biomechanical changes that happen. But even people that have never been pregnant, we all go through menopause. There's a certain time where our ovaries will stop producing the hormones, one of which estrogen. Our pelvis loves estrogen. So in and around the tissues of our vagina, in and around the bladder, we have a lot of estrogen receptors. And when we no longer have circulating estrogen, those tissues become thinner and they become drier. There may be some sensations of burning. We have an increased risk of UTI, also because with less estrogen, the pH of our vagina changes as well. So it becomes less acidic, and we like an acidic vagina because it helps ward off those infections. So the most common changes are dryness, can be painful sex, more UTIs, and then also urinary incontinence and prolapse. So there's a big umbrella term now. They used to call it vaginal atrophy, which was drying and thinning of the tissues and narrowing of the vaginal walls. And now there's a bigger term. It's also bigger to say, menopause. GSM is the acronym, under which falls atrophy, dryness, UTIs, incontinence, prolapse, painful sex. So while the term atrophy was not loved, I don't know if genitourinary syndrome is necessarily the right term either, or loved equally, but there's a lot of change that happens in this part of the body, some of which has maybe been happening along the way. And maybe there's been gentle symptoms we've been able to sort of ignore or put a pad in and kind of carry on. And once we experience that full transition to, we're now moving post-menopause, unless we have, some support for those tissues, we can experience a lot of heightened symptoms or potentially symptoms for the first time.
And what are some of those symptoms that a woman could experience that would indicate the pelvic floor isn't working as well as it should, or as well as we'd like?
Mm-hmm. Yeah. So the most common forms of pelvic floor dysfunction would be incontinence. So most people have seen the ads that say that light bladder leakage is just part of being a woman, or you just need to put your sexy, black, wrinkly underwear on that are pads and everything will be fine. And I wholeheartedly disagree. I think we have a temporary place for products like that, but we should not be considering those as our norm or something that we need to accept as normal as we age. So that is stress urinary incontinence. And that's where a little bit of urine will leak out with a laugh, cough, sneeze, jump, sometimes even just standing up from a chair. So there's some sort of exertion that happens and our muscles don't react at the right time or with the right amount of force to close off the openings, and a little bit of urine leaks out. So that's the most common. Then we have urge incontinence, and that's where some sort of trigger happens and we all of a sudden have alarm bells and we are racing to get to the bathroom, and sometimes we don't make it. And that could be a complete release of the bladder or a little bit of urine leaking out. You can have a combination of the two, which would be mixed incontinence. You can also have anal incontinence where gas or stool would leak out, which is less common, but far more life altering. So that's kind of the incontinence umbrella. We then have prolapse. So prolapse is where the bladder, the uterus, and or the rectum, those are the three most common, but it can happen with the urethra and the intestines as well. But when they shift out of their proper anatomical position, they can start to bulge into or descend into the vagina. And this is more common statistically than incontinence. So incontinence is usually somewhere around like 1 in 3, and prolapse is 1 in 2 women will have some form of pelvic organ prolapse at some point in their life. And again, why is it that it's not until people are being diagnosed with this that they find out they have it, and they sometimes are 40, 50, 60 years old and nobody has ever told them about this. The third sort of grouping I would put in there would be pelvic pain. So that could be painful sex. It could be pelvic girdle pain. So pain in and around the joints of the pelvis. Pain also around the tissues. So around the vulva, vulvodynia, pain with insertion. So vaginismus or dyspareunia is painful sex. So there's several different types of pain that would be under the pelvic pain umbrella that would also fall under pelvic floor dysfunction, more common as we age again.
Gotcha. Thank you. I'm so like mind blown because I don't really know much of anything that you're talking about. So fascinating to get to understand it and hopefully, shed light on some things if people are experiencing symptoms related to it. So how do the needs of the pelvic floor change as we get older and go through the menopause journey and after?
Mm-hmm. In an ideal world, we would have had.
Avaya has changed my life.
Avaya has made me the woman I am today.
Avaya is my home.
Avaya is personal freedom.
Avaya is the reason my life continuously improves.
Let everyone in your life know about Avaya.
Everyone needs to know about this amazing company.
Thank you, Avaya, for appearing in my inbox.
What Ike Allen and Andy Anderson have created at Avaya is what the world needs.